There's three reasons why someone's hip clicks. The first reason, we're talking about the native hip here, and not someone that's had a joint replacement. The first reason it clicks is because of the psoas tendon. This is one of the tendons that runs through the pelvis, over the top of it and down, attaching to the inside part of the thigh bone on the lesser trochanter. But the tendon actually runs directly over the front of the hip joint itself. Now this can flick backwards and forwards, sometimes can cause clicking or a clunking sensation. The second cause is a labral tear. Now the labrum is the fibrocartilaginous structure that runs around the edge of the bony acetabulum, or the cup part of the hip on the pelvic side, and what this does is basically acts like a flange to deepen the joint and hold the femoral head in position. Unfortunately, sometimes people, especially people that are sporty or do activities that involve wide ranges of movements, can cause injury to the labrum, and this leads to a tear. A bit like a meniscal tear in a knee or cartilage tear in a knee, which people most commonly refer it to. Now what happens then is it can catch and click, and this can cause discomfort and pain, and it becomes inflamed. The third reason why the hip can click is because of the iliotibial band, as it runs down the outside of the hip joint on the lateral or outside part of the femur or thigh bone. Now the greater trochanter, which is the bump of bone that people feel when they grab the side of their hip, can flick backwards and forwards, usually more so in lax women, young girls rather, that can have greater ranges of motion, and they can actually move the greater trochanter behind the actual iliotibial band and then flick it forward and then move it back again, and this gives like a clunking. Now I remember when I was at university, one of the that lived in our halls could do this on demand, and basically she was telling us that the hip was dislocating, but it was only years later that I realised this wasn't actually the case. She was just basically clicking the iliotibial band over a greater trochanter, and it certainly did make quite a large clunk that we could actually hear it. Now, often people will grow out of this as they get older and they lose some of the range of motion, and the soft tissues get a bit stiffer. So there are the three main reasons why people's hips can click, and obviously the treatment for each one can be quite different.